Bismillahirrahmanirrahim. Quote of the day: Start each day with a grateful heart. Today, the topic of my presentation is Introduction to Water and Environment, and I will be presenting it under the supervision of Professor Dr. Saira Abdi. Learning outlines: Introduction to Environment and Sanitation, Achievement of a Healthy Environment, Environmental Problems in Developing Countries, Introduction to Water, Safe and Wholesome Water, Classification of Water-related Diseases and their Prevention, Recent Advances in MCQs. Learning objective. At the end of the presentation, participants will be able to define environment and sanitation, describe environmental problems in developing countries, the criteria for safe and wholesome water, its uses and classification of water-related diseases and their prevention. What is environment? The term environment implies all the external factors, living and non-living, material and non-material, which surround man. In its modern concept, environment includes not only the water, air, and soil that form our environment, but also the social and economic conditions under which we live. Components of environment. Environment has been divided into three components, all closely related: physical, water, air, soil, housing, waste, and radiation; biological, plant and animal life, including bacteria, viruses, insects, rodents, and animals; social, custom, culture, habits, income, occupation, religion, etc. Sanitation. The dictionary meaning of the word sanitation is the science of safeguarding health. One of the best definitions is that given by the National Sanitation Foundation of the USA, which is as follows: Sanitation is a way of life. It is the quality of living that is expressed in the clean home, the clean farm, the clean business, the clean neighborhood, and the clean community. Being a way of life, it must come from within the people. It is nourished by knowledge and grows as an obligation and an ideal in human relations. The term environmental sanitation has been defined by WHO as the control of all those factors in man's physical environment which exercise or may exercise a deleterious effect on its physical development, health, and survival. Achievement of a healthy environment. In the past, sanitation was centered on the sanitary disposal of human excreta. In action, the term sanitation covers the whole field of controlling the environment with a view to prevent disease and promote health. Man has already controlled a number of factors in its environment like food, water, housing, clothing, and sanitation. These controllable factors are those included in the standard of living. It is the control of these factors that has been responsible for considerable improvement in his health. The demographic growth and fast urbanization all over the world are bringing profound social and environmental changes. Therefore, the attainment of a healthy environment is becoming more and more complex. The term environmental sanitation is now being replaced by environmental health. Proper environmental health now requires the services of a public health qualified doctor, the epidemiologist, the public health engineer, the town planner, sociologist, economist, and the health inspector. A purely medical or engineering approach by itself is no longer sufficient. A combined multidisciplinary program of action is needed to achieve a healthy environment. Environmental problems in developing countries. One of the essential public healthcare elements is safe drinking water and sanitation. In 1990, more than 1 billion people in developing world lacked access to safe drinking water and nearly 2 billion people lacked an adequate system for disposing of their excreta. Feces deposited near homes contaminated drinking water, fish from polluted rivers and coastal waters, and agriculture produce. Fertilized with human waste are all health hazard. Water quantity is as important as water quality. Washing hands after defecation and before preparing food is of particular importance in reducing disease transmission, but without abundant water in or near home, hygiene becomes difficult or impossible. The lack of water supply and sanitation is the primary reason why diseases transmitted via feces are so common in developing countries. The most important of these diseases, diarrhea and intestinal worm infestation, account for 10% of the total burden of disease in developing countries. In addition, an inadequate water supply increases the risk of schistosomiasis, skin and eye infections, and guinea worm disease. According to the report, 94.31% of the population in developing countries are still without access to safe and clean water. More than half of the 2.5 billion people without improved sanitation live in India or China. As you can see from the pie chart below, the in India, there is majority of the population living without improved sanitation. Health for all. Two of the changes needed to achieve health for all are concerned with a healthy environment and healthy lifestyle and require initiatives by the individual, the family, and the community. Africa 2000, a new initiative aimed at providing universal coverage of water supply and sanitation services, was launched. A broad program for hygiene, education, and promotion of low cost sanitation is being developed in cooperation with UNICEF and bilateral and multilateral organizations. Key hygiene behaviors and principles for promoting sanitation were identified. The global WHO UNEP network for air and water quality monitoring are operational in more than 60 countries. Surface and groundwater quality are monitored in 350 cities worldwide. Introduction to water. Much of the ill health which affects humanity, especially in the developing countries, can be traced to the lack of safe and wholesome water supply. Water that is easily accessible, adequate in quantity, free from contamination, safe and readily available throughout the year. There can be no state of positive health and well-being without safe water. Water is not only a vital environmental factor to all forms of life, but it also has a great role to play in the socio-economic development of human population. Each country should develop its own water resource agency, which would collect all pertinent data on the water resources, exploitation, and hydrogeology. In 1981, the 34th World Health Assembly, in a resolution, emphasized that safe drinking water is a basic element of primary health care, which is the key to the attainment of health for all by the year 2018. More recently, Millennium Developmental Goals included safe water and sanitation in the attainable goals. Water is integrated with other primary health components because it is an essential part of the health education, food, nutrition, and also maternal child health. Key facts. Over 2 billion people live in water-stressed countries, which is expected to be exacerbated in some regions as a result of climate change and population growth. Globally, at least 2 billion people use a drinking water source contaminated with feces. Microbial contamination of drinking water as a result of contamination with feces poses the greatest risk to drinking water safety. While the most important chemical risk in drinking water arise from arsenic, fluoride, or nitrate, emerging contaminants such as pharmaceutical, pesticides, polyfluoroalkyl substances, and microplastics generate public concern. Safe and sufficient water facilitates the practice of hygiene, which is a key measure to prevent not only diarrheal disease but acute respiratory infections and numerous neglected tropical diseases. Microbiologically contaminated drinking water can transmit diseases such as diarrhea, cholera, dysentery, typhoid, and polio, and is estimated to cause 485,000 diarrheal diseases deaths each year. In 2020, 74% of the global population, 5.8 billion people, uses a safely managed drinking water surface, that is one located on the premises, available when needed and free from contamination. Safe and wholesome water. Water intended for human consumption should be both safe and wholesome. This has been defined as the water that is free from pathogenic agents, free from harmful chemical substances, pleasant to taste, that is free from color and odor, usable for domestic purposes. Water is said to be polluted or contaminated when it does not fulfill the above criteria. Water pollution is a growing hazard in many developing countries owing to the human activity. Water requirement. The basic physiological requirement for drinking water have been estimated at about 2 liters per head per day. This is just for survival. But from the standpoint of public health and improvement of the quality of life, water should be provided in adequate volume. It will help to reduce the incidence of many water-related diseases among the people most at risk. The consumption of water, however, depends upon climate condition, standard of living, and habits of the people. The daily supply of 150 to 200 liters per capita is considered as an adequate supply to meet the needs for all the urban domestic purposes. Uses of water, domestic use. On the domestic front, water is required for drinking, cooking, washing and bathing, flushing of toilets, gardening, etc. Public purposes, cleaning streets, recreational purposes like swimming pools, public fountains and ornamental ponds, fire protection, and public parks. Industrial purposes for processing and cooling, agriculture purpose, irrigation. Carrying away waste from all manner of establishment institutions, water is therefore an essential factor in the economic, social, and cultural development of a community. It can eliminate disease, promote rural development, and improve quality of life. Classification of water-related diseases, non-infectious water-related diseases. They are related to some chemical property of water and of major importance in developed countries. They are due to the ingestion of a harmful chemical, toxin, or carcinogen causing an acute reaction or acting as a cumulative poison. Infectious water-related diseases. In the tropics, about 5 to 10% of the deaths are due to water-related diseases, particularly among many young children, where malnutrition and infection are two major contributing factors. Intestinal infections related to water increase malnutrition and in turn predisposes to severe infections. Non-infectious water-related diseases, chemical contamination of water supply for drinking and cooking and adversely affect health. Following are the typical non-infectious diseases associated with water supplies, chemicals, iodine deficiency, goiter, excess fluoride dental fluorosis, fluoride deficiency dental caries, excess inorganic salts diarrhea, cadmium gastric upsets, sodium hypertension, sulfates laxative effect, nitrates and nitrites, methemoglobinemia. Typical non-infectious diseases associated with water supplies that are heavy metals, lead poisoning, arsenic, Blackfoot disease, arsenic skin and lung cancer, cadmium iti disease. The cadmium also causes nephropathia, mercury minimata disease, mercury nephropathia. Infectious water-related diseases. The modified Bradley classification for the infectious water-related diseases is as follows. Fecal-oral diseases, waterborne diseases, water-wash diseases, water-based diseases, water-related insect vector diseases, and water-dispersed diseases. Fecal-oral diseases. Infections transmitted by the fecal-oral route. They may be waterborne or water-washed. Examples are classical diarrheal diseases and dysenteries and includes ascariasis and hepatitis A. Waterborne diseases. They arise from contamination of water by human or animal feces or urine infected by pathogenic viruses or bacteria, which are directly transmitted when the water is drunk or used in preparation of food. Cholera and typhoid are the classical examples. Leptospirosis may be acquired through contact of abraded skin with infected water. Water wash diseases generally results from the lack of water for washing. The state of remaining unwashed not only allows skin infections to develop unchecked, but also makes intestinal infections to spread from one person to another on dirty fingers. Scarcity and inaccessibility of water makes water washing and personal cleanliness difficult and infrequent. In these cases, some diarrheal diseases and contagious eye and skin infections are prevalent. This category of disease also include infestation with lice or mice, which are vectors of various forms of typhus. They diminish whenever an adequate amount of water is available. Water-based diseases. There are some worm infections in the tropics which are not spread passively from person to person in the water. The parasitic eggs or larvae which reach water are not directly infective to man but are infective to specific invertebrate animals, chiefly snails and crustaceans. They undergo development within these intermediate hosts from which after a period of days or weeks further larvae mature and may be shed into water. These larvae are infective to man who is infected by drinking or contact with water. Water provides the habitat for the intermediate host organism in which some parasites pass part of their life cycle. These parasites are later the cause of helminthic disease in humans as their infective larval forms in fresh water find their way back to humans by boring through wet skin. Schistosomiasis being ingested with water plants, crustaceans, or fish, liver and lung fluke. Water-related insect vector diseases. Water may provide a habitat for the water-related insect vector of disease. Mosquitoes breed in water, and the adult mosquito may transmit malaria, filariasis, virus infections such as dengue, yellow fever, and Japanese encephalitis. Other arthropods too are water-related. Similium or black flies, the vector of river blindness, breed in moving water. Deer flies which transmit eye worm infection prefer muddy swamps. In the quest for increasing the availability of water for agriculture, industry, and domestic use, countries have unwittingly introduced these diseases into areas where do not exist. Water dispersed diseases. The agents proliferate in fresh water and enter the human body through the respiratory tract. Examples are the bacteria Legionella, which proliferate in the water of air conditioning systems and cause pneumonia, freshwater amoeba, which may lead to fatal meningitis, and the waterborne opportunistic infections like cryptosporidium. Examples of water-related infectious diseases: waterborne, cholera, typhoid, hepatitis; water wash, trachoma, scabies, dysentery; water-based, schistosomiasis, guinea worm; water-related insect vector, malaria, yellow fever, trypanosomiasis, onchocerciasis; water-dispersed Legionnaire's disease. 5 mechanisms of the water-related infectious disease transmission and preventive strategies appropriate to each mechanism. Waterborne, improve the preventive strategy would be to improve the water quality, prevent causal use of the unimproved sources. For water washed, improve the water quantity, improve accessibility to water, and improve the hygiene. Water-based, decrease need to water contact, control snail populations, improve quality. Water-related insect vector disease, improve surface water management, destroy breeding sites of insects. Water dispersed, cleaning of air ducts in the air conditioning systems. Way forward today with 5.5 billion people and well-drilling technologies capable of reaching water buried deep in the earth, human population for the first time are capable of depleting and polluting freshwater supplies on a massive scale. Governments must act now to prepare for the inevitable increase in population that will further strain their freshwater supplies, and they need to help create conditions that will encourage the stabilization of the population while there's still time to bring human needs and natural resources into sustainable balance. Recent advances: the impact of climate change on the waterborne diseases in Pakistan. Climate change has become a potential threat to human health in the past half century. The risk associated with waterborne disease due to changes in the climatic patterns is increasing all over the world. This article reviews the available literature on the increased and potential impact of the waterborne diseases on human health, particularly those resulting from changes of climate patterns in Pakistan. The discussion focuses on the increased exposure to pathogens associated mainly with temperature rise and floods resulting from intense rainfall events. Developing countries, including Pakistan, are more vulnerable to threats of climate changes, which add to the waterborne diseases risk due to poor sanitation and sewerage systems, inappropriate water management, lack of healthcare facilities, social and environmental factors. Among bacterial pathogens, E. coli, Salmonella, Shigella, Cryptosporidium, and Campylobacter are the main causative agents of the waterborne diseases such as diarrhea, hepatitis, cholera, typhoid, malaria, salmonellosis, dysentery, schistosomiasis, and giardiasis, all of which are becoming more frequent. In addition to these outbreaks, climate change are expected to increase the challenges of water availability and exposure to unsafe water. Future projections of climate based on current rates of change predict increased variations in rainfall patterns and melting glaciers, which will lead to an exponential increase in pathogen concentration in water bodies. As disease outbreaks become more frequent, the impact on health is clear. This article proposes actions to reduce further health threats from outbreaks of waterborne diseases through the development of mitigation and adaptation measures put into national water policy, including infrastructure development that assures potable water quality control, improved medical intervention, and the development of process-based models for risk. Water sanitation problem in Pakistan, a review on disease prevalence, strategies for treatment and prevention. The global water crisis is expected to worsen if urgent action is not taken in making sustainable amends. This applies to Pakistan as the entire country suffers massively from poor water sanitation. Waterborne diseases are rising exponentially, attributed to rise in microbial infestation, trace elements, and drug toxicity in many water bodies of Pakistan. Treatment and preventive strategies must be implemented through national authorities at the individual level. Awareness on the use of clean water must be emphasized, and proper administration of water management policies should be implemented. Immediate and active sustainability for water resources can ensure a safer future for Pakistan. Now it's time for MCQs. Water is said to be polluted or contaminated when it does not fulfill which of the following criteria? A, it should be packaged. B, it should be sparkling. C, should be colorless and odorless. D, should be abundant. E, should be at room temperature.
Alpha.
No, it's C, should be colorless and
C.
odorless.
C.
It's C. The attainment of a healthy environment is now becoming more and more complex. The term environmental sanitation is now being replaced with environmental health. Proper environmental health now requires the services of A, public health doctor and engineer, public health doctor and epidemiologist, public health engineer and town planner, health inspector and sociologist. E, public health doctor, public health engineer, epidemiologist, town planner, and health inspector.
E.
Yes, E is the right answer.
E.
Chemical contamination of water supplies can adversely affect health. For example, excessive amounts of nitrates and nitrites from agricultural fertilizer can seriously contaminate water sources and may be responsible for causing A, diarrhea, B, goiter, C, dental caries, D, methemoglobinemia, E, hypertension.
A.
No, it's D. Heavy
Oh, sorry.
metals like Heavy metals like mercury, cadmium, and zinc may also lead to disorders and diseases in man. Contamination of water from mercury can cause which disease? A, Itai disease, B, Blackfoot disease, C, diarrhea, D, nephropathia, E, lead poisoning.
It's D.
Anyone? It's D,
Alpha.
nephropathia. D. Whenever an adequate
Yes,
amount
D.
of water for washing or personal hygiene is available, the following diminish. A, water-based diseases, B, water-washed diseases, C, water-dispersed diseases, D, non-infectious water-related diseases, E. Water-related insect vector diseases. Anyone would like to answer this?
B.
Yes, B is the right answer. The agent proliferates in fresh water and enters the human body through the respiratory tract. The following category of infection is called water-related insect vector disease, water-based disease, water-wash disease, water-borne disease, and water-dispersed disease.
D.
Yes, B is the right answer. The following disease is water-dispersed. A. Malaria, B. Diarrhea, Legionnaire disease, D. Yellow fever, E. Scabies.
B.
No, C is the right answer. The following preventive strategy is appropriate to control water-related insect vector diseases. A. Aim to end up snail proliferation. B. Improve hygiene. C. Control snail population. D. Improve accessibility. E. Improve surface water management and destroy breeding sites of the insects. Anyone?
E. E.
B.
E is the right answer. Waterborne diseases arise from contamination of water with human or animal feces or urine and are directly transmitted when the water is drunk or used in preparation of food. Following are classical examples of this. A. Trachoma and scabies. B. Malaria and yellow fever. C. Dysentery, diarrhea. D. Cholera, typhoid. E. Schistosomiasis and guinea worm. The classical examples of waterborne.
D.
Yes, D. The following disease may be acquired through contact of abraded skin with infected water. A. Leptospirosis. B. Cryptosporidium. C. Trachoma. D. Schistosomiasis. And E. guinea worm.
D.
No, it's A. Leptospirosis.
A.
A.
This is the key. Thank you, everyone. And this is the link to the YouTube channel.
Thank you very much. A very informative presentation, and we have seen over the years that water and sanitation, one of a very important public health problem that has been emerged in every developing countries and most of those countries that are poor and in lower middle income groups. So it is very important to know. We have recently seen the cases of Nigeria and other countries who have suffered a lot because of the water scarcity and the related diseases that are waterborne, water washed, water based, and other important diseases. We have also seen in certain areas, especially I want Dr. Alishba to incorporate in her presentation about the cases of Nigeria that has been reported and sent, and it is one of a very important public health problem that were seen in previous years. Similarly, this year, again, there were 18 deaths that were seen in again in the province of Sindh, and again they were related very much with water, sanitation, and other things. So this is some of the recent advances that have to be incorporated, like malaria, so that can be present in a swimming pool and can affect the human health. I have also given some comments on the presentation, and I have given them privately on the WhatsApp group. Dr. Lipa, please go through it and see that how we can further improve the PowerPoint presentations. Thank you very much, everyone. And once again, it is a very informative presentation. Well done. Allah
Thank you,
Thank you,
Hafiz.
madam.
ma'am. Allah Hafiz.